After a funding scare for early detection cancer screenings caused some hospitals in the state to temporarily pause appointments, the Centers for Disease Control finally came through last-minute funding in June.
Grant Green has the latest on how long the funding will last and why the program that receives funds for these services needs assurance that this won't happen again.
Access to services such as pap smears and mammograms remains so important for women in their healthcare journeys. And that's why for many public health officials, the All Women Count program remains so important. And now that they've got funding through next June, some of them feel a little bit more at rest than where they were 3 months ago.
The All Women Count program provides these services under the State Department of Health for women that fall under certain age ranges and income levels. Over 1,500 women were screened in 2024, and whether discussing those administering these services or receiving them, availability is important.
They got the funding, but if you're working there, you have to wonder to yourself, how long is this going to last? So having a consistent, we hear a lot about a consistent regulatory environment allowing businesses to thrive when they know what the rules are, right? And you want to be consistent, not changing every few months or so. It's the exact same in healthcare.
Ben Hansen with South Dakota's American Cancer Society's Cancer Action Network says even these early screenings can be expensive depending on body type needs and where someone lives.
That creates different types of tests, and then utilization of the machine creates the pricing structure for most providers. So if you're in an extremely rural area, it could cost sometimes between 4 to 5 times more than if you live in a Rapid City or a Sioux Falls to be utilizing the machine there.
Hansen says he hopes the CDC and Congress continue to keep these things in mind and avoid concerns of last-minute funding.
And as mentioned, a very important part of providing these services is consistency. So Hansen says it's important not that just funding lasts till June of 2026, but that the funding is consistent for years to come. In Sioux Falls, Grant Green, Dakota News Now.